love what I do because this gives me a chance to serve a unique population starting right from the fetal age group up until young adulthood with this unique set of conditions which they could be born with or they could acquire as time passes on. So heart symptoms can present differently in different age groups. In babies, it can present as difficulty feeding in terms of getting tired, sweating, or fast breathing, or not being able to complete their feeds at all. Difficulty breathing or fast breathing even while at rest, bluish discoloration of the lips, tongue, or nail beds, or have trouble gaining weight. Whereas in young adults or young children, it can present as chest pain, specifically with exercise, difficulty breathing again with physical activity or exercise, passing out again with physical activity or exercise, and persistent difficulty breathing even after having sought treatment for respiratory problems. In those situations, you should seek medical attention, and your pediatrician will determine if you need to follow up or get screened by a pediatric cardiologist. Having said that, I don't want parents to panic at the sight of any of these symptoms. I want them to seek medical attention first with their pediatrician, and if their evaluation suggests, then they would be referred to a pediatric cardiologist. Some of the cardiac symptoms like chest pain, difficulty breathing, trouble gaining weight, getting tired very easily are non-specific symptoms, and these could mean that there could be some other systemic causes that could be causing these symptoms. So as much as I want you to get medical attention, I would urge parents not to panic at the sight of these symptoms and get evaluated before getting worried. If there is a family history of any close family member either being born with a heart problem, having a history of sudden death which no one knows the reason of, or having a history of stroke or heart attack before 50 years of age, then these kids should also be screened by a pediatric cardiologist. It is often seen that teenagers who are experiencing some cardiac symptoms like chest pain while playing or palpitations, they often hesitate to report it to either their parents or their coaches with the fear that they won't be allowed to play further. I want to let them know that this is not our aim. Instead, it's our aim to be able to screen them and make sure they can participate in sports safely. Also, being active and in being involved in sports is actually good for your heart in the long term. So I would not want any kid to sit out of sports if they don't have to. As far as parents are concerned, I want them to know that in pediatric age group, 95% of the times chest pain is not coming from the heart, and it is not as life-threatening as we think about it in adults. So seeking medical attention is important, but also knowing that it's probably not the heart that's causing that symptom. It is also often seen in our clinics that dizziness, especially in teenagers, is secondary to decreased water intake, not getting enough sleep, probably because they're on their phones all the time, or skipping breakfast. So making sure that your child does follow these recommendations of at least drinking 64 ounces of water a day, having good electrolyte intake, getting at least 7 to 8 hours of sleep a night, and not skipping meals would ensure that they can overcome these symptoms of theirs. When your pediatrician refers you to a pediatric cardiologist, typically we will do a history and physical examination. In addition to that, we will also get a screening electrocardiogram. If there is anything suggestive in the history or the screening electrocardiogram that requires an echocardiogram, we would go ahead and proceed with that. And based on those results, there are other modalities that we have for testing, but it is not common for every child to go through them. So based on a case by case basis, we can do some more testing, which could mean a cardiac CT, cardiac MRI, cardiac cath, or a stress test, all of which are available locally here in Jacksonville at the Wilson Children's Hospital.